Think big, exactly. Think big, start small, most importantly, launch loud.
See the problem throughout it, see
Correct.
the opportunities
Correct.
throughout it.
We make sure that industry know that we are here to play.
Hi everyone, and welcome back to Control Shifter, a podcast by SmartDev and Vericel AI featuring voices that take control, tell stories that drive the shift. Today we're joined by someone who is leading that shift, but at a really system level. Sandip is the Chief Digital Innovation Officer with a rare blend of strategy, technology, and also clinical experience. And he worked across continents, both from public and private health system, and he brings a whole system view on how transformation really happened. Welcome to Control Shifter, Sandip. Once again, thank you so much for joining us today. Would you like to share a little bit about yourself for the audience before we jump in?
It's excellent to be on your podcast. I love this concept about control shift, right? And the idea that, people are shifting industry forward. I love that. So thanks for having me on. Just a little bit about me. I'm joining here from Dubai, new to Dubai, about 8 months in, really loving the energy and the ambition of the entire ecosystem here, actually, not just healthcare, but all the expats and all the locals that we meet here are really driving for building that future. So someone like me who's really addicted to making that future a reality today, it's a perfect environment for me. So for me, my career, I grew up in finance and corporate finance. So I spent a lot of time in even kind of back office and front office finance and transactions. Got exposed to projects and kind of fell in love with transformation and turnaround really early on. And then shifted to management consultancy and for 5 years worked with a breadth of clients, all public sector, largely public sector, or maybe PPPs, in local government, in healthcare, education, and treasury. So I really got a broad view of what it takes to run a social service. But fell in love with healthcare. Um, Healthcare, and I'm sure we'll talk about it, but healthcare is, for the folks that love innovation, one of the most complex and adaptive and challenging, but also opportunity-rich environment. Largely the first chief transformation officer in a university hospital in Australia, in a system. Spent, some amazing years there, built some amazing connections, really proud of what we achieved in such a short amount of time. And here I am in UAE, in Dubai, doing it all over again, and really trying to make and build what is the future of health, today. So that idea of next today, that's the place that I live and breathe. And again, I'll draw out some of the examples, but that's just that's a snapshot of me. I'm an overactive adult. And maybe it's undiagnosed something else. But I'm a person who's a C-suite member, but rolls my sleeves up and gets into the detail. And I'm addicted to this idea of just making today better than yesterday, not just about technology. I'm sure we'll talk a lot about that, but how do we bionically transform an organization in terms of both those digital experiences and the technologies that we use, but also the leadership qualities, the culture, and that human experience all merging together, and transforming all lanes together.
From a lot of industry, and you said that you fell in love with healthcare and fell in love with digital transformation. So you've been going through across different industry and different stacks like that. What thing has stayed constant in your digital transformation approach across all of these shifts that you've been through?
One of the biggest things when I talk to colleague technical technologists, right, and I often describe this is often people just don't have an appreciation or depth of understanding of even words like AI and what it actually means. And so my career has allowed me to come from the business commercial side working then with boards and C-suite or frontline leaders, key opinion leaders, and then into technology. I came reversed, right? I didn't grow up as like a coder or an infrastructure side, etc. I came from business into technology. And what advantage that gave me is I came from a world in my background where I knew what the key organizational priorities were. One of the things that I continually remind my colleagues in CIOs, networks, etc., is if you walk into a C-suite room or a board and say, hey, I want to deploy a new Gen AI data platform, 99% of the people in that room have got absolutely zero idea what you mean. But if you walked into that same room and said, you know what, I think we lose 25% of our customers when they're on our website, and that's resulting in significant loss of, our revenue and driving, inefficiency in our profits and bottom line. But I think that if I think I've got a technology that can help better engage and convert those patients at the moment or those customers at the moment in which they're interacting with us. And I think that I could get a 20% improvement on that. Then it's such a different angle, right? I didn't come in saying I want a Gen AI program that does blah. I came in saying I want to solve a business problem, and actually I think I've got a technology solution that can do that. And here's what I think is the bottom line impact. And so for me, I spend a lot of time, kind of nesting that egg, that forcing that marriage between business problems and what technology can offer. And again, because I was a management consultant and I learnt the hard way about how to get in and quickly diagnose the problem and drive in the behaviors as to the underlying drivers as to what's influencing that problem and looking at potential ways to affect and drive small amounts of change, and then how technology plays a role. I think I have a great advantage in that way, in business acumen, commercial understanding, consultancy experience, and a depth of knowledge in technology and how that all nests together. And also I'm a lunatic, so I like to just get in, get things done, figure it out, and drive impact. My favorite saying of this year actually is think big, start small, but launch loud. I love that, Nesta. 25 years ago, people wouldn't even know who the IT team was. The only time you'd ever engage with an IT officer was, hey, my laptop's not working, or I forgot my password, right? But now technologists are driving the business. They are augmenting the omni-channel experience. They are the reasons why you're converting customers on web, or they're actually driving your workflows. Agentic reliance, meaning that the technical team is actually the team that's completing that task or that workflow. And so we've come all the way to the front, you know, and I think great message to me to this community is, let's actually think about the significant importance we play in organizations now. Let's really understand the problems that our organizations are faced with, and let's be loud about it and be proud about it, and really start showcasing, sharing, driving, what is that new frontier today.
And yeah, totally like the quote of yours, think big, start small. I believe first thing we need to start to work on digital initiatives is to see what is the problem that we need to solve and what the technology could solve it. And you previously saying that you've been working on system diagnosis, and we also previously shared in the previous call also is you identify the core problem maybe just around more than or less than a month, which is very impressive because those process usually takes us more than 2-3 months or even more than that. So maybe let's dive deeper in that. How did you really figure out, really ran a diagnostic in your first month? And what thing that you did, what practice did you involve to come up with a problem statement?
When I joined Kings, it was the second time I had the title of Chief Innovation or Chief Transformation, right? You interplay with both, you know. And I've lived and breathed, Chief Transformation Officer like title for 5 years and came into it. And I know what that looks like now. I felt it. Now people think, oh, you're the Chief Innovation guy. What a job. But believe me, when you're in this role, you know, not everyone, particularly clinicians, want innovation to happen, right? My medical colleagues would happily support me. People that are very concerned and have to be convinced. They have to be concerned by nature because if you're a physician, you're often trying to investigate what the actual problem is here, right? So it's medically, that's what you do as a doctor, and people that are very conservative too, right? That's the kind of culture. So walking into an organisation with a chief innovation officer title this time, chief digital and innovation, it carries a certain permutation, and innovation done properly is hard because you have to really deeply understand the problem. But coming in second time, again in a similar role that I previously was, I knew that what I had to quickly do is understand very quickly what the core problems were. What are the core problems in our organizations? Problems, opportunities, cup half empty, cup half full, whichever version. Let's talk about a positive spin, opportunity. What are the opportunities in the organization? What is holding us back from getting from here to here? And I quite quickly diagnosed that, and what I did this time around was went to the C-suite quickly and said, look, this is what I believe are the key issues that's facing us. And this is where I believe you want to go. This is where I believe you want to be. And I won't talk specifics because that obviously, will release some of our own IP. But this is where you want to be generalized as an organization. Do you all agree you want to be here? Whatever it is, whether it be a workforce retention issue or a revenue issue or a customer experience issue or opportunity, again, whichever way you want to interplay the words. And so let's agree that we want to be here. Excellent. All right. These are the things that we would need to do to be able to get here. And not just, again, technology looking for a problem, but actually these are the things that we would need to do on our org structure, on our workforce models, on our resourcing, etc. But constantly playing back to, but you really want to be. We all agree we want to be here. That's the ambition that we all set. And me constantly looking at, okay, what is it stopping us? What's that differential? How do I get you from A to B? And in the space of 30 days, we had a very clearly articulated plan, had all of our early initiatives launched, and we actually delivered some innovation within the first 30 days, from conceptualization into implementation, all from this concept that I toyed with about how do I set what the future is and work backwards from there, and how do I articulate a plan and a vision, strategy, a set of sprints that get us to that future prospect, that future desired state, and then how do I measure it so that when I had to go to the board, I articulated the same vision, same strategy that we had agreed as a C-suite in their words to get their approval to say that if we did execute this first set of initiatives, it would result in this outcome. I worked with the executive team to set a desired future state. I then explained what are the challenges, opportunities that we would need to get from here to there to solve? What would we need to do better? But always playing back where we wanted to be and then looking at where the opportunities, problems were, and then finally talking about what elements of that entire vision would require technology change, technology investment, and how technology could help. So a very different way. And I have to say 8 months into this agenda, it has been one of the most exciting methodologies that I've ever run in my career, where I'm now in having delivered multiple initiatives, doing large transformation. And I didn't wait the first 100 days. We were there in 30 days and off we were. And that plan is still to this day, 8 months in, the same plan that we're executing.
That's awesome. I would say we not, for example, when we're talking about identify the problem, like we usually find, oh, this where's the problem? Where's the problem? But you actually plan out the vision first with your um, communication with the executive level. Identify, okay, do you agree to be at this place? Do you want to be maybe um at this kind of level? I would say that it reflects well with the quote that you emphasized earlier, which is think big but start small. So maybe have a clear vision up front, and then you start working on all the initiatives ahead. See the problem throughout it. See
Correct.
the opportunities throughout it, which is really, I mean, mind blowing because yeah, when we talk about identify the problem, fix the problem. For example, if that business doesn't have much problem that is above the iceberg, right?
Think big, exactly. Think big, start small, most importantly, launch loud. We made sure that industry know that we are here to play and we are here to do it seriously, because we basically said we're going to take some really bold stance forward, launching mammogram AI, ambient listening, real first in region. Um, we're doing some really interesting innovation. But you absolutely nailed it, right? What's the trick in that? What's the trick in that recipe? I made sure that the C-suite and then obviously the board understood that we wanted to go from here to here, and if that was the set foundation of the vision and ambition that we had, then it would be much easier for me to draw out. Okay, if you want to go from here to here, these are the things that are not going to allow you to do it. Do you agree that the things that I've said are the problems or opportunities that are holding us back from getting from here to here? Yes, I do. Excellent. Let me then talk to you about what we need to do. Very different. And so that act of having to convince, initiative by initiative, project by project, goes completely away in that game, because all I ever have to do is say, hey, but we all said that we wanted to be here. That's what we all said, and I'm just trying to help you get there.
But maybe let's use a broader question for this. So after all of these implementation been rolled out, so if you could improve one thing that digital transformation processes, what part of that you want to optimize the most?
If I was to reflect on my first day, and that's a good question, right? Because I'm only 8 months in. What would I change? I probably, not probably, I definitely would go, and retrospect's a great thing, but I would go back and make sure that everyone around me at multiple layers had more opportunity with me to explain what technology can really do. You know, I think I drew on this point earlier actually, and walk into a room, say the word Gen AI. Just because you've lived and breathed this as a technologist does not mean that anyone else in that room has any understanding of what the hell you're talking to. Often been training, with my 6-year-old son, saying, "Hey, his name's Noah." I said, "No, what do you think of this explanation?" And just looking at him, being like, "I've got no idea what you're talking about, Dad." It's so solidifying because it's like sometimes probably how, not that I'm comparing my colleagues to a 6-year-old boy, they've got much more intellect and are further developed, but you get my point, right? You've got to speak in layman's language. And so what would what's the wrapper here? I would change one thing, which is spending more time with colleague leaders and colleague directors and some of the team leaders one on one, and investing in their knowledge so that, when it came 7, 8 months down the track, I wasn't having to go back and, oh, yeah, maybe you don't even know what a CRM is actually. I'm just assuming that you do. And I've assumed that you've gone along this agenda, but you might have missed that part of the agenda, or you might be a new player on the team. And so that was one thing I'd change. I would have invested more time in not only educating, but investing in my colleagues so that they knew, I could increase their baseline knowledge, so that, when we're accelerating, we're not driving this differential curve of knowledge, and we're suddenly here, delivering AI projects where people are still trying to figure out what is a data pipeline or what is an API, blah. So that'd be one thing I'd change. Absolutely.
Yeah. So it's all back to um having all people understand the the goal that you're talking about and see, translating, because different department, different part of the organization will understand that vision differently, right? And maybe
Correct.
what you want to fix is spending more time to let them understand that how this vision
Absolutely.
gonna
Absolutely.
do
Nailed
it,
it.
gonna.
Nailed it. Nailed it. And no one wants to look stupid, right? We all know that. No one wants to look in any meeting. But if you're not layering knowledge, and suddenly, you're driving a layered approach to transformation, and suddenly you drive step changes, which again, in my own bias, someone like me loves this big, let's disrupt and let's do massive step changes, which is great and excellent, because that's why you brought me into the organization. Sure, that comes with the role description. But the issue with that is, if you're not helping layer knowledge and you suddenly go from nothing to, AI mammography, and you haven't showcased and shared, what is even foundational AI, etc. It'll hurt you down the downstream, because it's kind of like building you got a one-story house, and suddenly you're building the third story, but you haven't even fixed the foundations of the one story to know that it can hold three stories. As an example, you're at risk of the whole thing collapsing, right? So that's probably what I would spend more time on.
So that is investing more time to talk with people to understanding them. So I think it's also a really good takeaway for executives level who are listening to this as well. Whenever you work on change initiatives or any other digital innovation practices in the organization. Now
Right.
let's switch into the transformation part. So let's fast forward to a thing that you are exciting about, the AI-driven agentic interfaces and a project that you work on, which is called Yara. What does this agent solve in practice, and how it is changing your daily workflows or the team inside the hospital?
One thing that, if you're in healthcare, you'll know, and you'll see many verbiage and nomenclature around this, is how much administration burden our staff are faced with each day, right? And you walk into a hospital and you'll notice, you know, administration assistants, and you'll notice, clinically trained staff like nursing doing a lot of administration work, like following up on bookings or scheduling a patient in, or just finding out if the results are published or completed, etc. And then you'll even find it with our physicians. I mean, how many times do you go to a doctor, relevant to context, whether it's in Singapore, whether it's in London, whether it's in Naples, whether it's in Sydney in Australia, etc., or Dubai, and you're talking to you might have waited 6 months to see this specialist, and what you notice straight away is that they talk for 2 minutes and they're typing, right? Like, there's so much administration burden placed on hospitals, and we know that. We all feel that. We all experience it. You've all, you know, for a positive reason or a negative reason, have to go to healthcare. Healthcare is for all, right? It's universal. Um, and so, what Agentic, excites me so much is the ability to drive out some of that mundane work, you know, whether it be as simple as following up an invoice every day that you have to do as a nurse, and, I think we all experience this in our lives. Sometimes you do a task so often that you go on autopilot. You can't switch off, right? You're like driving to work, you're on autopilot, or um, you know, looking at your calendar in the morning, you're on autopilot. And so how do we take all this mundane work away so that clinicians in particular can reinvest it into the things that they're passionate about, which is caring for their patients, right? So when we came to UAE, great opportunity to partner with such an emerging ecosystem that's growing here. And one company that we came across is a company called Yara, which is YARA. It's born by a new startup team. We spoke to them nearly in day zero when they were building a platform ready to showcase. And we started, and we are live in this, right? So live discussion started iterating on, wow, the power of agents, being able to task and finish all this manual work. And that's that, like, unless you're in healthcare, you would really know what I'm talking about. There's a great photo actually. You can look it up on Google. If you just look up Google Images and say, how much paper does it take you to be admitted to a UK hospital? And there's a great photo of this clinician laying on the ground, and there's like, 3 meters of paperwork for admission documentation. Same as any other hospital, really, across the world. So yeah, working with Yara to really drive this kind of mundane work out. And the best thing about healthcare is it's protocolized and controlled, so it's a great place to use agentic AI because processes are often well documented. It's a very controlled environment, so it's very easy to then go and automate, replicate, and then drive out. But that's the baseline use case. But what's really exciting me about the work with Yara is the idea that you can create agents that are simulated twins of the individual. If you think about this deeply, the problem that we've had as an industry with being able to automate a theatre schedule is largely been about the variation not only of procedure, but of the individual clinician delivering that procedure and also the team that's supporting them in that environment. And there's been many studies around if I have, as a surgeon, a dedicated team that works with me through and through, I will be able to drive efficiency in output, in procedures, interventions, because that team knows how I work and knows how I deliver that case. And yes, there may be causal variation inside the procedure depending on that individual patient. Yes, I agree. That's semi-unpredictable, fine. But it's not largely the main drivers of variation. So what am I getting into? Well, there's a reality that with Yara, we can actually build a theatre scheduling platform where we build an agent for every surgeon, we build an agent for every team, we build an overarching scheduling model, and then we look at the actual patient demand, and we actually use agentic AI to solve, which is a relatively unsolved problem with a relative level of efficiency and trust, to use agentic AI to drive out complete theatre scheduling. That's the stuff that really excites me.
Yep, I believe that's really a life changer for every hospital as well because from a perspective of I'm not yet working in hospital context, but as a maybe a patient, I all of these administration things are also really time consuming for me to have me cure something, right? And this thing is not just boost operational efficiency, but it also enhance the customer experience as well. All of the healthcare access should not be burdened by all of these time consuming administration tasks.
Say this is the exact example of think big, start small, launch loud. Have we achieved this yet? Absolutely not. Have we picked the right partner to help us do it? Absolutely. Do we understand the problem statement and the opportunity? Absolutely. You know, TBA 6 months. Let's see how far we can get because, but that's what agentic can really offer us.
So we are talking about agentic, and previously we were have a little discuss on the user interface or the user experience system. So previously, in agentic AI communities, they have another term instead of saying the people who developing the system is programmer. They call them flowgrammer. They know how to arrange each this task in a very structurized flow. And there's more people with that label showing up currently, and we can see how people are hyping a lot about it. And the thing is interesting is Agentic AI is open the door for a whole new UX area, right? And since we're on in talking about that space, well, I would like to ask about the person who really worked directly in this product, which is you. So how has this shifted you thinking about the
Yeah.
UX system and user design?
This is a big conversation. This is fun. This is fun because if we think about it, we've spent a long time thinking about user-centric design and human factors and user experience and user interface and companies have spent tens if not millions of dollars curating, testing, A/B testing their websites and their apps, etc. But here's a thought: more people are shifting to search and action in LLMs, where whether it's Claude or whether it's Llama, whether it's Perplexity, whatever. It's not too far that those platforms will be integrated into the platforms that need to go and do the next task, right? And so I'm in this like internal mental debate right now of like, hang on a second. If I really think about this, if a patient wants to come and book an appointment at King's, they might just jump on Claude and say, I want to show me the next slot availability. Actually, no, it was that earlier. Hey, I've got a sore throat. Excellent. What does that mean? It might mean that you've got a respiratory infection. Great. Who would I need to see for respiratory infection? Well, you could go and see a general medical doctor, or you could go and see, someone who works in respiratory. Great. Excellent. What are the best hospitals that are around me that provide those services? Oh, well, it looks like King's has general medical staff that have a special interest in respiratory. Blah. Excellent. Can you go in and book me an appointment? Or, you can keep playing in this. Who's the most qualified person on that team? You know what can happen, and I've been debating about this, is my whole UX UI is no longer relevant. What is relevant to me is I've got an API exposed that's in a safe way, exposed to multiple LLMs that make sure that if that person wants to go in and book an appointment with Dr. A or Dr. B, they do it in chat. This is kind of blowing my mind a little bit because, I'm in complete conflict. Because yes, it's easy to go and now design. You talk about this idea of flow grammars. It's easy to go and design and map out customer journeys, absolutely. And it's easy to think traditionally about we have really good user experience, we're going to have less clicks, we're going to convert really high, and blah. That's all the language that you get if you go to a traditional conference, sure. But how about the world where no one ever visits your website anymore? What happens to UX UI? Now it's a really interesting trade-off because it's like, do I hedge my bets and spend in a world where you've got finite resources and I know this is happening, I know it's coming, and people are, let's face it, let's be honest, people are searching more in agents on platforms now than they are on traditional search functionalities or search platforms. Come on, let's be very real. And more and more people are driving that adoption. It's increasing, day by day. And if I could convert the action from that platform, what the hell happens to my whole user experience? I don't need a nice website anymore. I just need to make sure that my APIs are exposed in one way that can help that person convert that task, or that an agent can navigate my screen quickly enough. I'm in internal conflict right now. It's an internal conflict about, let's make sure that, because we've all got finite resources, let's make sure that we do have a strong UX UI, absolutely, but also let's know that that world could fade when no one's even coming to my website anymore. So
Yeah, we potentially no longer need spend more time on searching a thing and then scan through each single website to find whether we have the information that we need. So it's already happened in the current age already, where people just search a some query on Perplexity or GPT, right? They will put out the output and with the source attached, rather than they think about the company and they search on the company and to find that that information piece, they find it all on all of these LLM model. Yep, I believe with the growth of Agentic AI here is we maybe no longer investing much on buttons or interface is a very high chance here, and we're going to be focused more on the system or how the data and how the queries of the customer could process and flow in a logical way. Very exciting to look ahead. But
exciting, and not that I'm old school, but you build character and friction, right? Like you build as a human, you build your own character and the tough times that you go through. Sometimes they're the times in life, whether it's a bad breakup or whatever it may be, right? I'm sure we could all print out a list of the things that have been tough for us as individuals. You build character in that. And one thing that does it concern me potentially is if the world's so frictionless, where are the moments that you build your character? If it's so easy to, I mean, Dubai, blow your mind that you can literally order petrol home. You don't have to even go to the petrol store anymore. Someone will drive around and fill your car up, right? Like you can. I ordered I bought my son and my daughter actually. I bought them a football, like a soccer ball, and I forgot to buy a pump. But where do you build character when there's no friction, right? So so it's a big question. It's deeper, but and maybe we'll all shift, and there'll be other things that we have to spend our time on. That's hard, but that's
yeah,
something that I think about.
I like the way you mentioned about the characters here, because yeah, there's a research recently conducted by a very pretty famous university in the US. They say that ChatGPT makes people get dumber because we're just seeking for the answer. We're not thinking and solve it by ourselves. We're just finding it on ChatGPT, and that is just give us a bunch of answer that look exactly right, and we just go with that. So it would be a concern here is when we're talking about creativities and things, right? For example, if you want to paint it by yourself, but you ask the GPT to do it, there's no your color in that, and it's the same with thinking as well.
True.
The way of thinking is not going to be the same as what GPT output, and those things are still very concerning. So we already know that new concept, new innovations usually easily get some pushback, right? And I think this is the one many director level also would love to hear is what kind of frictions did you encounter during the rollout or during the pitch with the C-suite, culturally, operationally, or even emotionally?
Yeah, I've encountered in my life from midway through implementation, team gets disengaged, budget gets pulled, poor buy-in at the start. Again, I remember I said the story about behind the blue suit and the white shirt that I'm wearing today, I've got many scars and stories that I've learned today. Absolutely. For directors, I think it's important for leaders that are growing up right now, through their career, to know that you're going to experience hurdles, but if you're really committed to the end goal, you'll get through them. Whether it be scope creep, time delay, leadership, exit, buy-in, whatever it may be, you'll get through it. And I think it's really important that you surround yourself with people, or at least have access to people in your network that have been there and done it before, because they'll give you those inches of wisdom that will last you, those inches that will last you miles. So it's really important for leaders, whether you call it mentor, whatever you want to call it, to have access to people that have been there and done it before. Because I've been there and I've done it before, and I have some amazing stories about innovations that were truly way ahead of their time that dramatically failed. because we didn't solve the right problem, or we didn't engage and explain exactly why we were doing it, or even better, the world's moved on. How many times you're in an innovation these days in Martech's law, right? Technology is changing at an exponential rate. If you're trying to deliver a strategy that's 3 years old, I guarantee you are way out of the ballpark now. I can guarantee you that. And so, my message again to directors is, really understand the problem that you're solving. Know there's going to be hurdles, issues, barriers. Surround yourself with people that have been there and done it before. Always tell your leadership the truth about whether it's on track or not. I believe you talk to any of my current team, you talk to my previous leaders that used to work with me, I always used to say, red is good, i.e., tell me now, let's work through it together. Because if you tell me 2 days before it's implementation and I've got commitments all across the business, then I have a problem because you didn't escalate early enough. So bring forward your issues, network, exchange ideas. You're going to have challenges. You'll have every simulation of a challenge in your life if you're truly driving, innovation and at scale. But just work through it, and I'm sure you'll get through it.
What advice you would give to your younger self before stepping into this role, the role that you're working on, the CDO role?
What advice I'd give to myself is to enjoy the journey. It's such a pithy thing to say. Innovation is hard. Wearing that label, being the person in the room is at times the most difficult challenge you'll face. Because if you're the chief innovation officer in every room that you work in, everyone will assume that you're there to make it better, to drive change, and not everyone is built the same way as my colleagues in the innovation world are. And I burnt the candle at midnight many times, and I've had some really interesting, rough, challenging times in my career. It's like, why am I doing this? And no one believes me and blah. All I'd say to my younger self is trust the journey. And to my current self, when people are working around me, driving, whether it be my director of transformation, operational innovation, or whether it be my director of digital, I commonly ingest that in them now to say, let's have some fun with this, because I know it's going to be hard, but hey, we're going to get through it. And so, that main message I'd say to my younger self is just enjoy it more, because it's also a beautiful thing to work in innovation, particularly in healthcare. Um, and uh, and and I reflect back at my career. I've had so many amazing moments, and even learnt so much about myself in those hard times. And I would never change a thing. I would just tell my younger self, you know what, just enjoy it more. And that passion, that drive, that excitement, that energy. Again, if you knew me on the ground, working with me, that energy emulates out of me every day now, and I just really enjoy what I do. One last word, if you've got a great idea at work and you don't share it with anyone, it's an idea that will die. you know. So that thing that you're sitting on that you really believe can change the trajectory of your organization or your team, I give you one last challenge. Write it down, debate it with Claude or Perplexity to make it really sound, put some evidence in it, and go and knock on that leader's door and say, hey, I want to share with you an idea that I have to improve culture or to improve the financial bottom line or to improve whatever it is. So my challenge to you all is to do it, because I guarantee you in my career, becoming an early executive at 31, leading some of the most amazing projects at 27 and 28, was because I was that guy at a very young age with completely no experience that still went up to the CEO and said, hey, I want to do this. And because I did that, I am where I am today.
Yep, I can feel that from maybe just 1 hour talking with you. I can feel that inspiration you brought from the person who's speaking with you. And okay, Sandip, thank you so much. Your clarity, boldness, mind-blowing insight that you brought and also with a position as a C-level here are really, really rare as well. I believe this gives our audience a new perspective regarding how the C-level, like you approach of the innovation practices, and your insight will be the next wave for other innovations leaders as well. So thank you so much for joining Control Shifter. So listener, this is Control Shifter with Sandip. Thanks for tuning in, and we'll catch you next time.